Yeah, we hear a lot about managing and trying to control asthma. Are there things that parents can do on an everyday basis to help that?
I think the most important thing, I mean, obviously, for kids with allergic asthma, we try to do the best we can to reduce exposure to the allergens. Sometimes easier said than done. Say if the kid has a cat, yes, and is allergic to the cat, yes, it's a good idea to get rid of the cat. But it's sort of hard to get rid of tree and grass pollen because they're just sort of there. I think sort of the most important thing that parents can do is to make sure that the child is taking the medication and that it's being used correctly. Because if there is good compliance, there will likely be very good outcomes.
So, so is the answer really getting rid of Fluffy?
It can occasionally be. I will tell you though, the only time that I ever see a patient getting rid of the cat is when their child is allergic to it. Adults are willing to suffer. If they watch their children suffer, they're more willing to get rid of the animal.
Okay. And just for the record, are there really any hypoallergenic pets out there?
So I know that's a little bit of a misnomer, and there is no truly technically hypoallergenic dog, cat. They all produce dander. I will tell you though that I hear countless people. It's funny. I have an hypoallergenic dog myself, and people always say, "Well, do you have that because you're allergist?" I say, "No, because my dog's cute. I mean, that's why I have my dog." But there are several people that say that they are better around a certain type of dog, okay, than others, and they do better, and their symptoms are less. So I always tell people, look, if somebody really wants to have a pet, go spend a few days with the pet. You know, have the pet in your house or go somewhere, where you're around the pet. You'll know real quickly. Hold on, lights back on. You'll realize really quickly whether your child is allergic or not. It doesn't take long to figure that out.
Okay. Now, is there anything else you think would be good for parents to know?
I think it's most important for parents to know that asthma can be easily managed. Okay, and I do see a lot of parents that worry about the side effects of medications, and I get that, and I understand that. Unfortunately, the best proven treatments for asthma for patients that have chronic asthma are usually inhaled steroids, okay, or things like Singulair. But usually the most efficacious is inhaled steroids, and I know there's a lot of concern in the community about using steroids, and not to say that these medications are without any potential side effects, but the good management of children's asthma is the most important thing for that child's health, immediate and long term, and will ultimately be most beneficial to that child's development. And really, the amount of side effects that we see from any of these medications is really minuscule, and for the most cases, pretty darn rare.
Thanks for being with us.
It's my
And
pleasure.
if anybody watching today wants to get a hold of you, what's the best way to do that?
We have a website which is www.centurycityallergy.com. They can they can call our office through that number. They can email me through that website, and I also have both a Facebook and a Twitter link as well.
Fantastic. Thanks again, Mark. Thanks for being with us today.
It's my pleasure.